I'm here to talk to you guys today, and we do have a nice chunk of time together. But we're going to talk a little bit about anxiety, and anxiety is something that, as a psychiatrist, is bread and butter, both in the adults that I see and in the children that I see as well. And unfortunately, with today's politically charged climate and economic uncertainty, it's something that's certainly not going away and is probably getting worse, and so it's something that I think we really need to pay attention to, not only in ourselves and in our families, but in the larger community around us, so that we can try to have some positive impact here. And so without further ado, let's get started. Please, I'm somebody who, if you have a question that you don't want to forget, because I know I would, don't hesitate to raise your hand at any time, and we can tackle things as we go. So, just what are we going to cover today? Just a kind of a handful of topics, brief overline. So, what's the difference between anxiety and stress? Because there is a difference. How does it affect the body? Um, I work at the Amen Clinic as one of the psychiatrists. So we do brain SPECT imaging. It's a functional imaging of the brain, and it is a very useful tool in a number of ways. So we'll talk a little bit about what it shows, particularly with things like anxiety and PTSD. How we can use faith, spiritual wellness as healing tools, and then some other, outside the box, outside of medication treatments that we might, consider integrating in our own practice or helping others to integrate themselves. And then, how churches, how communities, how these larger groups can help both individually and a larger society context. And so, let's talk about anxiety versus stress and what's the difference. And what I tell my patients, it's a little different from this, but this is a great little summary. I say anxiety and stress are different because stress plays by the rules. You have a situation that comes up, you get stressed, you deal with the situation, because stress can actually be a good thing. It can motivate us, it can empower us. We get through the situation, stress goes away. Anxiety doesn't play by the rules. It does not care if there is a situation to be stressed about or not. It can be there all the time. It comes out to play when it decides it wants to come out and play, and it goes away when it decides it wants to go away. And some people might deal with episodic anxiety, some people might deal with very chronic anxiety, some people might deal with like obsessive compulsive disorder type anxiety. So there's a lot of different flavors of anxiety. But what makes it anxiety is it doesn't play by the rules. And that can obviously be very impairing for people. And statistically speaking, there's at least a couple of us in here who do deal with anxiety or have had a diagnosis at some point in time. And you know exactly what I'm talking about. And so, what we also know about anxiety, right, is that, if it becomes chronic or toxic, whether that be chronic toxic stress that doesn't go away, and unfortunately we see this in a lot of groups who deal with things like, impoverishment, abuse, but anything that really causes a lot of dysregulation in our fight or flight system that we cannot escape from eventually turns into a kind of a hard wiring of the brain in these ways that will often end up in a diagnosis of something like PTSD. And we know that PTSD can be a single event, like a nasty car accident, an assault, but it can also be the result of chronic toxic stress. And so this is why it's really important that we, through our lifestyle, through our church, through whatever means we can, that we are doing what we can to help release that stress so that it doesn't hardwire itself in these nasty ways. So let's talk a little bit about, well, how does this work in the body, right? Because of course, while it's an incredibly complex thing, our nervous system, when we're learning more and more about it every day, there's some basic tenets, right? And that is that, anxiety kind of derives from our body's alarm system. Anxiety, stress, these things are designed to keep us safe. The areas of our brain that, if dysregulated, will cause anxiety are really there to help us flee from danger, to keep us safe, the fight or flight system. And we want this system to work appropriately so that we can fight the danger or flee the danger if it's there. But of course, If that becomes dysregulated, then we run into problems. And there are hormones that are involved. So our nervous system might cause us to release things like adrenaline, which is what's going to immediately get your heart rate thumping and you're going to feel that. And then cortisol. Cortisol is that more chronic stress relieving, chronic stress released hormone. And this is the one that makes people gain weight and causes fatigue and causes all sorts of medical problems, which is why we see, rates of things like heart disease and et cetera at much higher rates in people who deal with anxiety. That cortisol is pretty nasty stuff if it's there for too long. And so if it's always on, we're going to have a problem. So we want it to work. We want it to shut off when it's appropriate. And so we think about this in a couple of different ways. This is kind of how I describe the nervous system to my patients when we're talking about things like anxiety. And that we have our parasympathetic, our fight or flight nervous system, and then we have our sympathetic, and then we have our parasympathetic, and that's your rest digest. And these work antagonistically to each other. So if one's turned on too high, the other one's generally going to be shut down. If we want to relax, we need to find ways to increase our parasympathetic nervous system and tone down our sympathetic nervous system. And what happens in anxiety is that our sympathetic nervous system takes over, and so our gas pedal is never allowed to release, nor do the brakes, our parasympathetic nervous system, ever really get a chance to be pushed. And so we quickly turn into a runaway train. The vagus nerve, this is a interesting nerve, and there's a lot of research and new treatment options that go into modulating this nerve. But this is the nerve that goes from the brain all the way down into the guts and is the control center of our parasympathetic nervous system. So more vagus equals more calm. So when we think about this nervous system as a runaway train, right? Too much sympathetic all the time, not enough parasympathetic, which is what we see in anxiety in a basic sense. Well, how does this affect the body, right? So sleep problems, and anybody who's ever been stressed, I mean, it's we all have dealt with a bad night's sleep because we got something going on. Chronically, though, that can turn into a huge problem. Sleep is when our brain heals. It's when our brain and body do a lot of the things it needs to do to stay well. And so if anxiety is causing us to not sleep well, you can guarantee that's going to cascade into a lot of other problems. Headaches, stomach issues, the gut brain connection. We'll talk more about that in a minute, but this is a very real thing. And in kids, we see a lot more of those, what we call somatic or physical symptoms of anxiety. So, if you've got a kiddo or you hear about a kiddo who, has always got stomach aches and always feeling physically something's going on, you might think, could this be anxiety? It very well may. High blood pressure, elevated heart rate. Again, sometimes that's a appropriate short-term response because we get some adrenaline, say after a car accident or something like that. But chronically, high blood pressure is a problem. It kills a lot of people every year. Same thing with things like blood sugar issues. We think about diabetes. And then memory, focus, and mood, right? I mean, if you're anxious, it's hard to be in a good mood if you're anxious. You're going to be a bit cranky. Same thing if you're sleep deprived. We know that if you're anxious, you're worried, you've got all these stuck thoughts, good luck focusing on things. So it's more than just an emotional disorder. It's a very much a cognitive disorder as well, and a physical disorder. So when we look at the brain under stress, some of the kind of big areas that we see, and again, this is very simplified, but there's an area called the amygdala. Now you have two amygdala, one on each side. They live in your temporal lobe. Amygdala actually means little almond. So if you ever get a Jeopardy question asking what the amygdala means, it means little almond. And it does because it's a small almond-sized, almond-shaped structure that lives on each side of your brain. And the amygdala is one part of our anxiety network in our brain, but it's a major part. And this is an area that's been studied extensively in PTSD because it causes, if it gets hyperactive or dysregulated, or again, if that brake gets stuck or that gas pedal gets stuck and we have no brakes, we get mood instability, we get irritability, we get anger, we get anxiety, we get all sorts of problems when this amygdala starts acting up on us. The prefrontal cortex. So this is another part of our brake system. The prefrontal cortex is our executive center. So if this doesn't work well, think of things like ADHD. We don't make good decisions. We're more impulsive. Our short term memory, our focus, our organization, all of these things suffer. And what we know about our emotional system, these anxiety networks, mood networks that live deep in our brain, is that they're an older, more I'm going to use the word primitive structure. There's nothing primitive about them, but they're the deeper you go in the brain, the more your brain will prioritize giving fuel to that area because generally speaking, deeper parts of the brain are more vital for life. If you have a stroke in your right hemisphere, you might lose some use of your left side of your body. If you have a brainstem stroke, you're probably going to die. You're not going to even make it to the hospital. So the deeper you go, the more essential it is to life. And as a result, if these emotional centers are wilding out on us, our brain will naturally rob from Peter to pay Paul. So it will take resources from our prefrontal cortex, from our temporal lobes, our cognitive and memory centers, and divert those resources to these areas that are eating way more than their fair fill, right? So that becomes a problem because then all of a sudden, not only do we deal with something like anxiety and we're stressed and we're trying to get through all of this, but now our decision making abilities drop as well. This becomes a really big problem when we think about things like suicide or people who choose to escape anxiety through substance use. You don't want somebody who's anxious and whose decision making center is impaired because they're going to make some really bad decisions. The hippocampus. So the hippocampus is another area in our temporal lobes that's very close to our amygdala and also can be affected by long-term stress. Great example of this is in PTSD. We see things like dissociation, where people will lose memories of it, lose memory of experiences, flashbacks. This is when our amygdala and our hippocampus start talking to each other, and all of a sudden our hippocampus puts us back in that situation and it feels very very real, or we forget these situations entirely and our brain puts them away in that box in the dark corner, and then we've got to go to things like EMDR to kind of help sort that out. This is all kind of regulated by our temporal lobes and by our hippocampus and our amygdala, and anxiety is really good at making these areas become very dysregulated and do things that they're not supposed to do. So, physiologically, when we think, okay, they've got these areas of the brain that are getting funky on us, and what can that do further downstream, right? Because this idea that our brain and our body are two separate things, which is kind of an antiquated term. I think we're moving past that, fortunately. But anything that affects this affects this, and anything that affects this affects this. We're one entity. And so we get more cortisol, we get more of these stress hormones released by our what we call our HPA excess. Sorry for the odd volume. Um, and over time, that can cause us to become what we call sensitized to these chemicals, where we become intolerant to it. So we produce more and more and more of them, and eventually we can actually start to exhaust the glands, the areas of our body that release these things, and then we get things like a kind of a catch term is like adrenal fatigue, which some people don't believe is a real thing, but I've seen it enough to say that it absolutely is. And long term, that can become a really big problem for everything from blood sugar regulation to energy to sleep to weight gain and many, many other problems. Inflammation. We know that under times of stress, be that psychological, physical, our immune system will kick up and start releasing these little chemicals into our body that we call cytokines. And there's lots of different cytokines, but these cytokines cause inflammation. Inflammation is actually part of the healing process. But too much inflammation for too long causes elevated rates of things like cancer, shortens our lifespan, causes pain, or worsens pre-existing chronic pain, and a whole host of other problems. So we could sit here for all day and talk about inflammation. just just that, but it's chronic inflammation is a big deal. The gut brain link. This is, everyone has probably heard of well, listen to, what does your gut say? Listen to your gut. I got a gut feeling, right? And that's because our gut has its own nervous system. We call it the enteric nervous system, and the gut's nervous system responds very similarly to our central nervous system. And there's a lot of connection between the two. This is why, if you've ever been scared or if you ever get nervous, you feel butterflies in your stomach. It's your gut's nervous system reacting to the anxiety, just like your brain is, just like every other part of your body does. But that's appropriate. It's appropriate to feel butterflies in our stomach. It's appropriate to get this. Chronic excessive stress, i.e., anxiety, over time can cause more inflammation in the gut. The gut's nervous system stops working as well as it should. We get increased cellular permeability in our gut, so we stop losing the ability to absorb nutrients correctly. And the bacteria in our gut, which we have exponentially more bacteria in our gut than we do cells in our body. And a lot of these bacteria produce things like serotonin. In fact, over 90% of serotonin produced in our body, which serotonin is the feel good chemical. That's what we modulate with meds like Prozac and Zoloft and your SSRIs. It's all produced in the gut by these bacteria. So if those bacteria get thrown out of whack, you can you can believe that that's going to cause a lot of problems. And one of the big problems that it causes is it worsens our anxiety. So then we get stuck in these loops where things just get worse and worse and worse unless something is able to stop that and bring us back out of that hole. And then, of course, we talked about sleep already a little bit. There was a really big meta-analysis done, well, 2 3 years ago. A meta-analysis is when they take a bunch of different research projects on kind of the same thing, and then they combine these and they do this statistical data. And it's in the scientific world there, it's kind of hailed as some of the strongest evidence-based literature. So meta-analysis are, if you can show something with a meta-analysis, scientists go, probably. And generally you get really large numbers because you're combining multiple studies. And there was a study done, big meta-analysis done, and I think the end sample size, when you put everything together, it was well over 100,000 people. So it was a big number, scientifically. And they showed without a doubt very clearly that if we want to live longer, feel better, be happier, have less chronic disease, um, we will prioritize sleep over any other lifestyle factor. Diet's important, exercise is important, everything else is important, but the one thing we can do to live a longer, happier, healthier life that makes the most difference is sleep. And anything that disrupts that sleep, like anxiety, is going to cause a lot of problems because, again, like I said earlier, sleep is when our brain heals. It's when our brain's nervous system or not nervous system, I'm sorry, immune system kicks on, sweeps out all the junk. It's like, the grocery store, it closes at night. The night crew comes in, stocks the shelves, gets everything pretty. Well, imagine if the night crew never came into this grocery store. Eventually, it's going to get rough. I wouldn't go to the bathroom there. I'd stay out of that. I'll hold it till I get home, thank you. But that's what happens in the brain too. And that's what happens in lots of other parts of our body. We know that children, before we become adults, when we're growing, most growth happens when we sleep. So, sleep is even that. This is why kids need more sleep than adults, is because there's a bunch of things that is going on in their body when they're sleeping that don't happen anymore when we become adults. And so we simply need less sleep. It's a little more complicated than that, but that's a basic premises. So sleep is a big deal, and anxiety, stress really rocks our sleep. And I have this conversation with patients multiple times a week. I say, the first thing we're going to do is get you sleeping well. If we can do that, now some patients actually sleep well, and that's great, but a lot of them don't. I say, if we can do that, everything else is either going to get better or it's going to be easier to get it better because your body will be in and your brain will be in a better state. So I'll get off my soapbox on sleep, but it's a big deal. Well, for a minute until we get to a few slides and then we talk about it again. If I sound like a broken record, it's very intentional. Yes. Yes. That's right. I could do the Ben Stein voice. Yeah. Remember Ben Stein? Yep. Yep. Clear eyes. Awesome. So, so, individually, obviously, anxiety is a big deal. In families, anxiety is a big deal. And if one person deals with it, everybody deals with it. But, in the broader community, anxiety is a big deal too, right? Because it's a pretty common disorder and it's very, depending on what form of anxiety. Like I said, there's a lot of flavors, but anxiety as a whole is incredibly common in society as far as numbers go when we look at psychiatric conditions, and it's only growing. Unfortunately, it's not shrinking. But people, like I said, people who are in an anxious state tend to not make good decisions. We tend to make emotionally charged decisions. And that can be everything from getting into a fight uh, to walking into a school with a gun, right? It is a big deal. We have to help our society spend less time in emotion mind and more time in logic mind. And anxiety makes it really difficult to do that. But just some things, right? When we think about individuals, right, and how that could impact society. Well, school performance, parenting, marriages, job stability, right? Lost performance at work, increases isolation, healthcare costs and burnout. Burnout in healthcare is a huge thing. You talk to any nurse, doctor, anybody in the healthcare industry, especially COVID times, a big problem. We saw a huge jump in suicide rates in the healthcare profession, during that time. And so you can imagine how that impacts society. It doesn't take a doctor to figure that one out. You know, and I think, and this is a big one, right? Church. So we think about churches, and something I deal with a lot, even to this day, is people. A lot of people are still very resistant to getting mental health care, getting therapy, but people aren't generally resistant to going to church, to reaching to their faith, to talking to their pastor, or their elder, or their bishop. There's lots of different religions, different things, and churches generally are very open, welcoming places, and if they can actively offer that support, they're going to be offering that support to a lot of people who will accept it from their church, but maybe still reluctant to accept it from a psychiatrist or a therapist or even their family members. And so it puts ministers, it puts people, religious and faith leaders, in a really amazing position to do a lot of good, not only for the individual but also for society, because people trust their faith and they trust the people that guide them in their faith. And enough cannot be said about how powerful this can be, as a tool to help our society. So let's switch gears now. Not a great segue. I didn't have anything funny, but let's talk about SPECT imaging, because again, this is what I do. I spend a lot of time geeking out over SPECT scans. I love it. It's so much fun for me. I can't believe they pay me for it, to be honest. Um, but what is SPECT imaging? Well, it's something that we at the Amen Clinic do. It's kind of the core of our practice. And a SPECT image is a functional image. So, if you've ever gone to the doctor or the hospital, you've gotten an MRI, a CT, an X-ray. These imaging modalities are looking at the structure. They're looking at the tissue, and they can see what it looks like. And if there's something wrong, that they can identify it. They have their place and they're really important. But SPECT imaging, being a functional image, does not necessarily look at the structure. It looks at what the structure is doing, and in our case, the brain. And this can help us identify areas that are working too hard, areas that aren't working hard enough, and areas that seem to be working okay. And when we think about psychiatric conditions, most 98% of the time, psychiatric conditions are not a structural disorder. The brain is structurally just fine. It's a functional disorder. So you can't appreciate or evaluate a functional disorder with a structural image. Um, with the rare occasion of things like strokes, dementia, right? There obviously there are exceptions to that. And so by looking at the brain, by looking at the organ that we're treating in this way, it can really help us to better understand what's actually going on. And then we get to move beyond subjective symptoms to objective medical data. And so in anxiety specifically, what are we going to see? If somebody comes into my office, they say, I've been dealing with anxiety, I've been dealing with OCD, I've been dealing with PTSD. What do I expect to see? Well, as we kind of talked about, the amygdala, insula, there's another areas called our basal ganglia, our anterior cingulate. These are the major components of our anxiety network in our brain. We're generally going to see these areas to be very overactive. They're going to be lit like a Christmas tree, lots of red, lots of white. These are the colors that we will often see them in. And that can really help us better understand the severity, help us to kind of delineate types and give us treatment targets that we can go after, because we know that if it's the anterior cingulate that's really high, we see that a lot in kids with like oppositional defiant disorder or an OCD. Well, we know that there are meds, supplements, treatments that are really good at treating that. If we see a lot of amygdala activation, which is much more common in the PTSD world, we know how to treat that. Basal ganglia, same thing. So it really gives us a better idea of what it is we're doing, what is going on. And I think even more impactful than that, as I mean, it makes my job a lot easier, but is the validation, right? When people have been struggling with a psychiatric illness for maybe their whole life, maybe other people in their life have told them that they're crazy or they're lazy or they're dumb or they just need to get over it. They've probably said it to themselves many, many times. And this personalization, can be really, really hard, and it raises a lot of stigma and it raises a lot of resistance to getting care. And when you can actually show them their brain on paper and say, look, this is a real medical condition with real medical findings. Here they are. It I mean, I can't even tell you how many times I've had patients and family members of patients burst into tears, because they finally, somebody finally understands, and they understand. And that can be really empowering for people, and it really help to decrease that stigma and that resistance toward getting care and whatever that looks like. And so, we think about PTSD, similar to anxiety. They look very similar on SPECT scans, with some differences, but we're going to see, as you can imagine, so the amygdala, the insula, these are areas that are involved in threat detection. Well, PTSD, you've been threatened, uh, maybe many, many times. And so the areas of your brain that are designed to detect threat and help keep us safe, they get jacked on and they do not turn off. We're generally going to see lower activity in those calming and control areas. We talked about that as well. Prefrontal cortex, some of these other areas that are actually involved in helping to regulate that. We're going to see less activity there. And we're going to see this kind of high alert, danger Will Robinson baseline in these areas at rest. Because again, their brain has had to learn from experience, unfortunately, that the world is a dangerous place and they can never put down their guard, never put down their guard. And when the brain learns that, it can be really, really, really tough to unlearn that. And that's where you get the chronic symptoms that you see in PT. Testing, test. All right. I think I accidentally turned it off. Sorry about that. So in practice, some of the things that again, that we can do. Yeah, it is. The batteries. Yeah. Cool. Water break. I could just yell at you. I made sure I was not going to make friends. I had. Well, that's the problem with over here. You just get used to cracking because if you don't, it's not really hard. And then that one day, here comes this freak storm. Yeah. You know? Yeah, I've had to clean drip drops off my doors more times than I'd like to. Oh, yes, ma'am. Unfortunately, not yet. That is very have been able to argue that in occasionally like dementia or transplant now yeah and research very clear that people work
Mark, are you able to use the microphone so we can hear online?
We're in a church and I'm being spoken to from above.
Yes, I'm way up above.
Hello. Yeah, it's a
There we go. Thank you so much.
well, the microphone. Oh, the microphone is dying. That's why.
Okay.
Just make sure hold it like here. Don't cover up the bottom. The bottom.
Okay. All right. Apparently the battery's not dead. So anyway, but back just to finish your question. So we're working on it. In psychiatry, not yet. In other fields, yes. Specs have been around for a long time. It's a very validated, acknowledged form of imaging, just like PET, fMRI. It's not the only functional imaging job and gig in town, but in psychiatry, it's not really there yet. And of course, some of that has to do with the fact that, getting insurance companies to pay for anything is incredibly difficult. They're not known for their awesome customer care. But the other unfortunate reality is that there's been a lot of resistance from our own peers in the psychiatric community in accepting SPECT scan as a valid and kind of the wave of the future in helping us to better diagnose and look at these things. Old habits die hard, and people get comfortable with the way that things have been going. And the simple fact is that while we have learned a lot about the physiology and the biology and the treatment of these conditions, in 99% of psychiatric clinics today, you are still diagnosed with whatever you were diagnosed with, the same way that Abraham Lincoln was diagnosed with depression, 170 years ago. We ask you questions, and if you say yes to enough things on a list, then you have this diagnosis. It hasn't changed. And there's lots of people, even in fellow psychiatrists, who are okay with that. And that attitude has to change. It is changing. And I do think in the next 10 to 20 years, it probably will start to become standard of care and we will see insurance covering it more. But that's the single reason we don't accept insurance. It's not that we don't want to. We want to get our care to everybody that we possibly can. But if they don't pay for the spec scan, so what do we do? Yes, sir. Good. Mhm.
Could they take that information through a psychiatrist like yourself and say, here's what my saw.
Mhm. Oh yeah. If they were able, I mean, if they were able through a neurologist or some other kind of, some other doctor to say get a spec scan and it would be covered under insurance, w- we would absolutely be able to take that information and do something with it. Just like when patients come to us and get a spec scan, often they take their scans to a neurologist, and the neurologist generally appreciates seeing that. Spec scans are, as far as things like traumatic brain injury and dementia of any form, SPEC scans are one of the best imaging modalities we have at not only detecting it, but seeing it. Like with TBIs, we can see TBIs decades after they've happened in SPEC scans, and the MRI will look completely normal. There's no structural damage. It's a functional thing. It's like that old knee injury that 30 years later is still bugging you. And then for dementia, we can often detect signs of dementia well before there's any structural damage or even clinical signs. There's certain patterns of underactivity that we know that if we see this and it fits and correlates with what the patient's experiencing, that even months or years before they can see it on an MRI, we might be able to diagnose it. Absolutely, I do. Yeah, 100%. And it may not get to medication there if we catch it early enough. Maybe we make some lifestyle changes, maybe we would do some supplementation. But yeah, the earlier you can catch it, the more you can slow it down. And we've even got medications out now that if you catch it early enough, you can essentially reverse it. Yeah. Yes, sir. Oh, fantastic. Mm-hmm. Mm-hmm. Sure. But yeah. Oh, absolutely.
Made a reasonable argument for a high degree of skepticism regarding what you're doing.
Mm-hmm.
That's what you're doing, the claims you're making based on images that are presented.
Mm-hmm.
And I'll leave it at that for the time being.
Well, no, but you're right. I mean, if we don't have skepticism, if we just accept something that comes through, how do we ever push to get the research to verify that it works or to further develop it into something, right? That's part of the process. I wouldn't I wouldn't trust anything that hasn't been met with skepticism because it it probably hasn't ever really then there's probably not been a lot of real validation behind it either. Yeah. Correct. Well, yeah, we can talk more about this later, but I would definitely encourage you to look that we actually, well, not just we, but us in a conglomeration with a few other academic institutions just had a really uh, major paper published in JAMA in April of this year, looking basically comparing spect some certain trends and spect findings and it was using four different cohorts, so it's kind of a case control study but larger. I think it was about 15,000 people combined, but comparing what the accuracy, the sensitivity, and the validity of certain specs findings in major depressive disorder versus things like cortical thickness in, say, an MRI, and and comparing, and the results were pretty clear. Now and we talk about, I'll talk about the limits, because there are limits to spec. I mean, there are limits, and I tell patients all the time, they ask me, I mean, okay, so this spec scan, it's gonna show that I have it'll show if I have if my son has autism, right? Or um uh, I got the spec scan, so do I have borderline personality disorder? By there are a lot of conditions that the, we simply just are, the technology is not good enough and we don't know enough. They're so complex that no, with there, that's it. that's not something that we can see on a SPECT. I can definitely use a SPECT, and I do, um, to uh, to help move past symptoms and treat the areas of the brain. And I mean, my results with my patients and other results in other clinicians in our system are, I mean, speak that it does work, but there's a lot that it doesn't show us as well. The other thing that I tell patients is the SPECT scan can show us what's going on, but it doesn't tell us why, right? It doesn't tell us if necessarily if your, if your hyperactive amygdala is due to PTSD or something else. That's where a very thorough clinical interview, the DSM, right? That's where the all of that becomes incredibly important, because SPECT scans by themselves are not diagnostic, and anybody that claims that they are is not accurate. Oh, we've got a lot of research. Yeah. Mhm. Yeah. Well, and we've got a long ways to go, and SPECT has a long ways to go as technology. I just know as a, as a new career psychiatrist, and in looking at medication failure rates, and looking, and talking to patients, and talking to other psychiatrists and other people in the mental health field, i- let's let's say spec's not the answer. That's fine. Maybe there's something better out there. Maybe this is all just a bunch of hogwash. I can attest that it's not. But what I will say is that if we don't try to get creative and find ways to do things better than we have over the last 150 years when it comes to diagnosing and treating mental health disorders, then we're stuck. Hmm. Oh yeah, as a nuclear medicine physician, yeah, absolutely. Yeah, we can't stagnate as a profession. Yeah, yeah, yeah. Of course, of course. But you do bring up a good point. Let's yeah, kind of moving on, right? So when we look at specs, some of the clinical nuances, right? So not, not everybody needs a spec scan, but when are they helpful? Treatment resistant symptoms, people who have failed multiple medications, people who the condition or the symptoms don't fit into a box. I see this a lot as a child psychiatrist. I see this a ton with kids who come in with an ADHD diagnosis, and they've failed multiple stimulants. They've had lots of things, and I look, and it's not their prefrontal cortex is fine. They have a lot of overactivity in their limbic area, and I've had a couple of doctors who have come to me, and they're like, what are you doing? Because I'll have a kid coming in with ADHD, and I don't put him on a stimulant. I put him on an anti-seizure mood stabilizer, and lo and behold, they get better quick. um but suspected TBI, right? So there's a lot of things. The validation to engage patient and family and care. Again, just the power of being able to see something objective, something concrete, something on paper that helps to explain why they've been struggling is so empowering to patients. Now, what are some of the confounders? And we, of course, we make sure that patients, when they come in their scans, we don't they are free of all of these things for a period of time. So caffeine, nicotine, sleep deprivation, there's a number of things that can definitely alter spect patterns and potentially, cloud our judgment on what we're seeing. When we look at, OCD, I actually had a patient just this morning, who I did an evaluation with, and being able to kind of differentiate that, and looking at OCD where we see a lot of bacteria in this area of the brain. It's kind of like a reverse mohawk if you look at it, but it's called the anterior cingulate. That's an area that, if you see a lot of activity there, you might suspect that that could be something going on. Trauma, we Trauma is called the great pretender, because trauma, nothing will light up your entire limbic, your emotional system, like PTSD will. Every area gets lit up. Depression, we know that depression is um, not just a emotional disorder, but very much a cognitive disorder. In fact, we have a term called pseudo dementia. And SPECT scans can be really helpful at assessing the degree of cognitive dysfunction when we look at things like the prefrontal cortex, when we look at the temporal lobes. These are those executive memory centers of our brain. Again, simplified, but essentially. Wow, that rain is coming down. Yeah, I have to talk over the rain here. So SPECT scans can definitely be helpful in a lot of cases, and these are the patients that that generally do come into our office, and they haven't had a lot of success other places, and in a lot of a lot of times we are able to succeed where they have struggled elsewhere. So looking at some treatments, right? Because we can talk all day about what we see, but well, how do we treat this, right? Now, of course, enough can't be said about good old fashioned psychotherapy, and there's a lot of different forms of psychotherapy out there, but we know that psychotherapy works. Again, if you can get insurance to cover it, there's probably something to it, and we can see very real changes on SPECT scans after people have gone through therapy. Definitely medications, and I use medications very frequently. If I do, it's part of a comprehensive plan, with the idea that hopefully if everything goes well, they won't need that medication anymore. But medications are a very, very necessary tool. And then, lifestyle, and that can be everything from sleep to grounding techniques, exercise, diet, ADHD coaching. I mean, there's so many things that we can do outside of traditional therapy and medications that can make a huge difference for people. So let's talk a little bit about one very critical domain, right? And you don't have to be religious or subscribe to a religion to experience the benefits of spiritual wellness, right? This sense of wholeness, this sense of larger purpose, this sense of just even the community, right? Being a part of something larger than ourselves. And there's a lot of good research to show that this can happen. There's been papers done that show that regular church and service attendance is linked to lower risks of things like depression and suicide and longevity. Prayer, worship, scripture, meditation. These are nice because these are things that we can do anytime. I mean, we can think, we can meditate, we can pray, we can breathe at almost any time in our day, and they can have very profound effects that we can measure in things like cortisol levels, and certainly subjectively, that we know can be extremely helpful. Sense of community, that sense of purpose. If we are alone, if we are isolated, if we feel like there's nobody out there that cares, which depression loves to do to us, it loves to put us in that headspace, then here comes hopelessness, here comes despair, and hopelessness and despair can very quickly lead to things like suicide. And we know that family, community, religion, our church, our gym, right? There are so many places that if we can encourage patients to get out and take part of and find that purpose, find that faith, can make as big or more a difference than any SSRI that I could throw their way. Gratitude and forgiveness. Who hasn't been wronged? Who hasn't been angry at another? And that anger and that resentment, put a lot of weight on our shoulders, psychologically and emotionally. And if we can let that go, if we can learn to love and to forgive, then how nice is it to free ourselves of that baggage. And again, there's research to show that things like gratitude and forgiveness can be really helpful. I regularly have my patients do gratitude journals, and it helps. Prayer is an exercise in gratitude. It's an exercise in mindfulness. It's much more than that to many people, but at its core, it's us taking a minute to say, I am thankful for, and that feels good. So some other kind of more logistical things that we can do. So things like daily quiet time, prayer, scripture reflection, um, are things that can be extremely helpful. And again, these are daily practices that we can integrate. They don't cost any money, and they take a few seconds out of our day, and they can make a massive difference. Song, when we're in church, when we're singing, music and song activates our temporal lobes and other parts of our brain in very unique ways, and can be extremely helpful at regulating our nervous system. There's that old adage, dance like nobody's watching, sing like nobody's listening, and it's more than just a fun little sign in your hallway or your bathroom. Of course, community, right? Small groups, service, mentorships, pastoral care, and again, being in a church setting gives people gives you a really unique way to help people because of the trust, and there's the ability for people to access that. It's amazing what some of the church and groups and organizations in this community and throughout the country do for people and for the community. And then, of course, going back down to these practices, things like a gratitude journal, things like lament and comfort psalms. These things have a very real psychological and emotional benefit if we're willing to put them into practice in our daily lives. So this is a little off. I realized it after I had already sent it. I was like, oh, I put this, so it's a little out of place, but my apologies. So when we think about sleep, I got on that soapbox earlier about sleep. Well, what are some things that we can do that actually work? So again, brain's creature of habit. So we know that if we can go to bed at a similar time every night, wake up at a similar time, we can instill these what we call diurnal patterns that can really help make it easier to know when it's time to fall asleep, know when it's time to wake up, and that makes a big difference. Wind down routines. This becomes really important for my kiddos, right? Helping them to develop a routine, and helping parents to develop a routine that that tells these deeper parts of our brain, hey, it's time to calm down. Limiting caffeine, limiting alcohol, extremely important. Half-life of caffeine, so how much is left after how long it takes for half of it to go away once you've consumed something. That's a half-life. About 8 to 10 hours for caffeine. So if you're drinking caffeine into the afternoon, you're still going to have a lot in your system when you go to bed, and that can affect sleep. What about when we wake up? Well, we can get up and do a quiet activity. So these are people with what we call sleep maintenance insomnia, people who wake up a lot throughout the night. We don't want to teach our brain that beds are a place to worry or to ruminate. Thank you, sir. Absolutely. Amen to that. Right. There's a few select things that we're doing in bed, and that's it. And so if we find ourselves in a place where we're laying there at night and there's nothing to distract us but our own thoughts, which people with anxiety have to deal with quite a bit, get up, do a light activity, get out of bed. Your brain needs to know that bed is for sleeping, not for worrying about the day. So that's huge, and that can make a big difference for decreasing those sleep maintenance things where we're waking up a lot at night and it's hard to fall back asleep. The typical, or the technical what you hear is the cliche, I can't turn my brain off. Well, nobody's brain ever turns off. It turns off one time, and that's it. It's it only turns off once. So it's about managing it. It's about managing it in the meantime, right? Um, so a couple of things like this one, I put magnesium is a big one. Pretty much every patient I have that comes in, and myself included, I put on magnesium. Magnesium glycinate's a very easy, accessible form of magnesium. But there's other ones out there as well. But we know magnesium actually helps the GABA system. GABA is your major relaxation neurotransmitter. More GABA equals calmer brain. Magnesium helps the GABA system work better it binds to a little receptor, hangs on to it, and allows it to work better. So magnesium can be really helpful for everything from anxiety to sleep to even muscle pain and post-workout. That's why a lot of post-workout formulas have magnesium in them. So It's good stuff. And it's an easy thing to buy and take. It makes a difference. Light exposure in the morning. Get up, see the blue sky, watch a sunrise if you're up that early. Depends on the time of year. But this does a lot to help maintain what we call our circadian rhythm, that natural sleep-wake cycle. So those are just, some very free and or low cost tips that we can do that can make a very big difference in our sleep. And we already talked about how important that is. So thinking about the simplest, cheapest, easiest thing that we can do to help ourselves feel better, that we have to do anyway, unless our brain shut down that one time, is breathing, right? There's some really great books on breathing, one called Breath that I recommend everybody check out. And there are some really therapeutic breathing techniques that you can do right now. You can do at your office. You can do in the car, that when that dude cuts you off and you want to flip him the bird. How about try a box breath? So there are some things that we can, with breath, that can make a big difference. And this happens in a couple of ways. One, it's an exercise in mindfulness. It takes us out of whatever's going on around us, causes us to focus on breathing, grounds us. Two is when we really expand that diaphragm like this, it actually stimulates that it actually stimulates this vagus and these phrenic nerves, these nerves that again help to stimulate our parasympathetic, our rest and digest nervous system. So if you take a big deep breath and you hold it, you'll feel that. You'll feel your heart rate slow. You'll feel these things. And this is a direct effect of stimulating that nerve as it runs from the brain down in through the diaphragm and into the stomach. So there's very real physiologic things behind this as well. Cool water face splash, cold plunges, triggers all sorts of interesting things. The dive reflex, which is a great hard reset for your autonomic fight or flight nervous system. So these are all ways through breathing and through these little tricks that can, again, make a huge difference for us, whether we deal with anxiety or stress or anything in between. So lifestyle foundation. So the sleep one was supposed to come after this, just so you guys know. We got the sleep. 7 to 9 hours is typically normal. There's variation in that. Everyone's a little different, but that 8 hours is a good golden rule. Screens. This is a big one with our kiddos. My 3 kiddos too. Everyone wants to be on a screen, and adults are no different. We want to blame it on kids, but there's a lot of adults who spend way too much time on their screen too. Well, we know that screens are stimulating for the brain. Certain wavelengths of light can help suppress melatonin production. And if we can eliminate screens 60 minutes before bed, that can make a huge difference for how easy it is for our brain to know it's night time. Lights in the house. Our primitive brain areas don't necessarily know the difference between these lights and sunlight. So if it's dark outside and we're lit like a Christmas tree in the house, that can confuse our brain. So we want to try to match our inside to our outside to the greatest extent possible. Don't turn your lights all the way off and trip and fall and hurt yourself. But low lighting at night does make a difference, and there's research to show that. Getting up in the morning, blue light, getting outside, going for a little walk, sitting on the porch, getting some of that morning light, again, been shown to be very helpful for waking us up, giving us more energy, increasing our alertness, and maintaining our circadian rhythm. Nutrition. So lo and behold, what we eat matters. If you feed yourself bad stuff, you don't feel good. If you feed yourself good stuff, you feel better. There's a lot of different diets out there. There's a lot of different foods out there, and there's no one size fits all approach to this. But with my patients, generally what I tell them, because I spend a lot of time talking about diet, is, to really keep it simple, unless they're already doing well in this regard, drink more water. If your body can only live 5 days without it, it's important. And cut out the crap. So minimize sugar, minimize the stuff that has ingredients you can't pronounce, shop more on the edges of the stores, produce, right? And then we go from there, right? Mediterranean style diets, diets full of unsaturated fats, limited meats, especially charred meats, processed meats, diets that are high in leafy greens, fish and seafood. Got to be careful where you get some of that from because of things like mercury and contaminants. But these diets tend to be very anti-inflammatory in nature, and good for the heart, et cetera. So there's a lot that we can do through nutrition to help us help feed our body what it needs. And our brain is the most metabolically active part of our body, gram per gram. It burns the most fuel. So it needs good, healthy things as much, if not more, than pretty much any other part of our body is. And if we eat well, we feel well here and here. Oh, no. Yeah, let's try this. All right. So, stimulant substances. I talk to my patients a lot about uh, the effects of things like caffeine, nicotine, alcohol, um, marijuana. That's a big one that's come up a lot. Now that it's legal, everyone thinks that marijuana is just okay, and it's not. It's not. Especially in the developing mind. If we were smart, marijuana wouldn't be legal until about 25 if we're going to keep it legal. But that's a whole nother talk for a whole nother day. But what we know is that caffeine directly stimulates these anxiety centers. And anyone who's ever had one too many cups of coffee knows what that feels like to have those anxiety centers overstimulated. So we got to watch the caffeine. Same thing with nicotine. Same thing. Alcohol, marijuana, these substances are great at helping to relieve anxiety. Oh my gosh. It's amazing what a couple of drinks, you just feel so good. The problem is that you feel too good. They're too good at it. And then when they leave the system, you get a lot of rebound hyperactivity. And then your brain goes, oh, hey, remember that thing that there's little areas called the nucleus accumbens and a couple other spots? Remember that thing that helped us feel so much better before? Let's have more of that. And then you have more. And then you have more. And then you have an addiction. Right. And even outside of addiction, people who, and I have a lot of patients who don't want to use alcohol in heavy amounts. They don't want to be potheads, but it's so far it's the only thing they've found that have given them some relief. And the problem is that they end up doing this. They drink, they smoke, they feel better, kinda, except for all the other problems. And then it goes away, and now they feel crap again. And so they're just living their life in this neurophysiologic, emotional, cognitive roller coaster. And it's probably not the best way to live life and function, and I think we can all agree on that. So be careful with this. It's not that everybody has to stop drinking or completely cut these out, though ideally they will. But we at least got to get them to a point where they're not roller coastering through life and they don't feel like they have to rely on these substances to make it through their day. If we can do that, then I consider that a win, at least for a lot of my patients. So we talked a little bit about the gut-brain connection. Again, food is important. We know that not only food feeds our body, but the foods we eat have a huge impact on our gut microbiome. Certain foods will cause our certain bacteria in our gut to grow more and less. And if we want our guts to have lots of good bacteria and not as much bad bacteria, well, we've got to eat healthy foods. Foods that are fermented, things like kefir, kimchi, yogurt, sauerkraut, these have a lot of naturally occurring bacteria in them that can be helpful. Probiotics can make a huge difference. I've had, I've done gut testing on people and put them on custom probiotics that have made them feel better than any SSRI that I can put them on. It takes time. It's not an overnight fix, but man, it makes a huge difference. When our gut works well, we tend to work a lot better too. Supplements, again, we're kind of getting outside of the medications and some of the things that we can do. There are some supplements with some decent evidence, though a lot of times these sample sizes are somewhat small, so we do have to be careful with supplements. People think that because it's natural that it's going to work and it's safe, and we know that that's not always the case. But there are some supplements that, especially if people are deficient in certain things like vitamin D, more people are deficient in vitamin D than have enough. It's crazy. But these are certain things that we know can help, and there's some evidence to back them. Omega-3s, great for the brain, amazing for the brain, amazing for the heart, can have a huge difference. not overnight, but they're good for us. And if we don't eat a lot of fish and get a naturally, we should probably be taking some. We talked about magnesium, L-theanine. L-theanine helps to promote what we call alpha waves in the brain. Alpha waves are when you're in the zone, calm, focus. L-theanine can be helpful. Saffron helps to regulate serotonin and increase serotonin levels, or at least it helps the serotonin system to work better, I should say. Lavender oil, there's a compound in there called selexin that has been shown to help anxiety. My wife actually I tried her on some selexin, and I was using a combination of selexin, saffron, and magnesium. I was able to get her off of her duloxetine that she was on for about 15 years. Um, so it was nice. She was already doing therapy. She was already doing a lot of things, but we tried some stuff out, and lo and behold, it was enough that yeah, she was able to get off her medication. I was really happy about that. And then of course, like I said, supplements are not benign. They can cause problems too. So before you just start, buying and taking every supplement that you see on TikTok or whatever, you should be having a discussion with your clinician about these things. Treat them like medicine because they can be. And just like medicine, they can have side effects and problems. So we talked a little bit about the vagus nerve, a little bit about mind body. So again, some of the things that we can do here: nature time, green space, getting out of the city, getting out of the pollution, getting out of the noise. You never feel better than when you're camping or hiking. At least I don't. Humming, chanting, singing, right? Social connection. These are all really important and stimulate the brain and the nervous system in very helpful ways. Mindfulness, prayer, meditation, right? Yoga, Tai Chi, exercise. Enough can't be said about exercise. But even if you're not going to go and join a CrossFit gym, there are some easy things like taking a walk that can make a huge difference for us physically and mentally as well. Digital. Oh, this is a big one. I had to do a slide on this. So the news, the news. If it's actually, we're going to call it news anymore. I don't know what to call it anymore. But I I have prescribed stop watching the news way more than I ever thought I would coming out of training. Because in today's it's so true. I will. Yeah, it's there. Yeah, stop watching so much news. It's it drives people nuts. It causes anger. It causes resentment, and it's hard to find true news anymore, and it's always coming at you 24 hours a day. And there's a lot of bad stuff that happens in our world, and it gets a lot of attention. And then there's a lot of good stuff that happens in a world, and it doesn't sell papers, so we don't see it. So we get this very negatively skewed view of our world that is then politically twisted, and it all ends in people feeling really, really anxious and angry and depressed and scared. There are plenty of things to be scared out there for sure, but we don't need it magnified by the news. And so we have to be careful about things. Social media, ideal news, typically the adults, social media, the teenagers and the kids. It's a big problem. Online bullying, I mean, the predatory stuff, that's electronic media in its various forms can be an amazing tool, or it can destroy us. It's really up to us as to what we want to do with it. So how can we want to, in that being said, we want to create tech-free zones, tech-free times. My kids don't take their phones to the dinner table. Well, only one is old enough to have a phone, but like we have very dedicated tech-free times and limits. And that is really helpful, not just for our kids, but we have to be doing it for ourselves as well. We really do. And then doom scrolling. So that's a kind of a newer term out there. But there's a lot of these new, what we call infinite feeds, where you can just literally sit here and scroll and scroll and scroll and scroll. TikTok is a great example. And the algorithms and the way these are designed is to hook you. And it's very addicting. And we see the same circuitry in the brain light up with these as we do when you gamble or you're craving for drugs. It's a big deal, and it can affect our brain. And so if we can replace things like doom scrolling with exercise, with socialization, with, you know, a little, maybe a little bit of prayer, um, it's amazing what that can do for how we feel and things like anxiety. It really is. I'm a child psychiatrist. Got to have a slide on children and teens. Got to do it. So again, when we think about anxiety, you can get all the emotional symptoms. You can get all of the mental symptoms, but kids tend to somaticize mental health conditions. So somaticize being feel it physically. And so if you have kiddos, if there's something that you're worried about, or you know a kiddo who experiences a lot of odd out of nowhere physical symptoms like stomach aches, big deal. School refusal. That's a good sign that there might be something going on at school. Withdrawal from, from family or from friends. Obviously, sleep, big one. For both anxiety and depression, a lot of times it will manifest itself not as sadness or worry, because some kids can't even really identify what that is yet, depending on the age. It manifest as irritability. They just seem cranky all the time. They're just short-tempered. They may not be able to tell you why, but these are red flags in kiddos that there might be something going on. Routine, super important. Kids are creatures of routine. This is why a lot of kids will do a lot better at school, and then they unleash hell when they come home. And part of that is that they feel safe and comfortable with us, and we want them to feel safe and comfortable at home. But a lot of it is also that school tends to be a much more regimented, predictable, routine environment. And kids tend to thrive in that. So if we can set routines up for our children, especially around things like nutrition, sleep, exercise, etc., these things can make a huge difference. Kids are they they have to breathe too, believe it or not. So if we can teach them simple breathing techniques, we can make a huge difference. One that I really love and I teach a lot of my younger kiddos is smell the flower. So pretend you hold the flower in your hand. Smell the flower and breathe out. And then smell it again, blowing bubbles. Take a breath in, blow the bubbles. These are fun little ways that kids can learn and reinforce some really effective breathing techniques. They don't understand box breathing. They don't get 4-6-4. What? But they understand sniff a flower, blow some bubbles. They get that. No, so these are ways we can help teach them these types of things. Hopefully, most young kids are not popping energy drinks and caffeine, but you'd be surprised. Adults are and teenagers are. And the problem with teenagers is that they tend to be drinking a lot more of it than parents realize. And yeah, again, it's a problem. It's a huge problem for kids, just like it is for us. And it can affect sleep, anxiety levels, all sorts of issues. So we've got to make sure that our kids are hopefully, not slamming Red Bulls. And then if a kid needs to talk, if they're struggling, well, who are they going to come to first? They're not going to drive themselves to a psychiatric clinic or an ER. So we have to be the safe adults that they come to, whether that be parents or other family members, whether that be church mentors. There are people in kids' lives that they will trust, that they will gravitate to. And these are the people that have to be willing and able to help a kiddo out if they're seeing that the kid is struggling, or if the kid comes to them and tells them they're struggling. So that's a huge piece too. So, just some ways that I think churches and communities can really, really help. The stigma, right? We talked a little bit about that. And again, I think as far as the SPECT scans are concerned, to me, I think the way that they are most powerful is, again, they tend to really destigmatize the mental health for the patient and the family, and can be really validating in a lot of ways. And we can do that in our culture, through our churches, through our support, because unfortunately the stigma around mental health is still a very real thing, especially in certain ethnicities, in certain cultures, and it causes people to not get the care that they need. And we can hopefully address that by creating a no stigma culture around mental health, normalizing it, making people understand that it is a medical condition, just like high blood pressure or diabetes is a medical condition. We can help train church leaders, youth leaders, other people that again have some sort of impact or spend time with people and have that trust in things like mental health first aid. There are free programs out there that we can learn, and that you can get certified in mental health first aid. And these types of things have been shown to dramatically decrease PTSD symptoms, intensity, and severity in people who have gone through traumas, et cetera, if if they're able to get this mental health first aid care. So that can be hugely helpful. And there are a lot of free programs that will teach people how to do this. It's not hard. We can offer support groups. So I think a big example of that we see a lot are things like Alcoholics Anonymous, often run in churches. These types of programs, these are really important, but it doesn't have to just be substance use. There, you can have a support group for anything. And churches are a great place to do those. We can develop relationships with local clinicians, therapists, and if a you know if one of our members comes to us and is struggling and we think maybe they need to go see somebody, maybe we have a card to give them or a phone number to call. And then I think most churches already do this pretty well, but it's creating those quiet, safe, peaceful places for prayer and for decompression, both before, during, and after services. So, these are just there's many other ways. I'm sure we could all get creative, but these are some of the big ones that at least came to my mind when I was creating this PowerPoint. So when do we need to seek help, right? Because of course, sometimes it's a little bigger than we are. So if anxiety is interfering with daily life, we should be reaching out to somebody. Things things we call panic attacks, these brief severe episodes of anxiety that can have crippling physical symptoms, and it can be incredibly debilitating. If people are experiencing this type of anxiety, they should be seeking help because that's a big deal. Trauma symptoms, chronic trauma symptoms, nightmares, flashbacks, hypervigilance. These types of things are generally going to be very distressing and cause a lot of dysfunction in people with things like PTSD. And then, of course, anybody who were worried that might hurt themselves or hurt others, they need to be getting help now, right? That might mean a trip to the ER, Mind 24/7, whatever it is. But we need to make sure that people are able to live to see another day to get the help that they need. Here are a few crisis resources. Many of you may already know these, but feel free to take them down or take a picture. 988 is the new suicide and crisis lifeline. So if somebody's experiencing a mental health emergency and they need somebody to talk to, that can be a great number. However, if there's immediate danger, change the 8s to 1s, call 911. You're never going to be in the wrong for calling 911 if you're worried that yourself or someone you love is in danger of hurting themselves or others. Home is another really good text crisis line that a lot of people, especially younger people, a phone that they don't. That's weird. They put it to the ear and they look at it funny, but they can text 1,000 words a minute, and so more comfortable if they or anybody is more comfortable texting, then that's an option as well. So there's a lot of great free resources out there that people can use, and not only patients but also the family of people that are struggling to help get them the help that they need. So these are just a few of them. So when we think about someone's journey through anxiety or depression or any other mental health issue, it's important to realize that it is a marathon, not a sprint, and that progress is steady, but generally not linear. There's going to be bumps, there's going to be ups and downs, and it's going to take time. Real healing takes time. We can treat symptoms with medications, but real healing takes time. It takes work, it takes effort, not just on the part of the psychiatrist, but on the part of the patient. Small daily habits, those baby steps, can make a huge difference. I tell this, I love this little say how I'll ask patients, so how do you eat an elephant? And they look at me like, what? And I go, well, how do you eat an elephant? Oh, one bite at a time, right? If we try to climb a mountain in one leap, good luck. But if we take it one small step at a time, knowing that every step is going to make a difference, eventually we'll get there. And and then, you know, healing is, this is a big, this is, I can't say enough about this one. I could just repeat this in a loop, but healing is always better if it's a team effort. It's faster in community, it's faster with family than in isolation. And when we think about risk factors for things like suicide, isolation is one of the biggest for a reason, because when we feel alone, it gets really hard to see a light at the end of the tunnel. And, you know, faith, you know, I end with this, you know, faith, spirituality, again, it offers meaning, it offers hope, it offers the promise of something bigger than us, it offers connection, it offers so many things that can help us endure the journey that for everybody is going to at times be difficult. So this is just to kind of put it into what can we do to, you know, maybe set a little bit of intention for ourselves, right? So in the morning or throughout the day, we can, you know, 5-minute prayer, some breathing, maybe a 10-minute walk. A few times a week, we can try to get a little bit of exercise, burn some calories, get our sweat on. In the evenings, we can lower the lights in our home. We can reduce screen time. We can pray. We can eat together at the dinner table. There's a lot of things that we can do there. We can set that consistent bedtime routine. Food, again, when it comes to food, baby steps. If you're not drinking enough water, and the way you'll know if you're drinking enough water, good rule of thumb is about half your body weight in ounces a day. So if you're 160 pounds, you should be drinking about 70 to 80 ounces. If you're going to use your urine, you should be peeing every 2 to 3 hours. It should come out light color. If those things aren't happening, you probably need to drink a bit more water, and that's a great place to start. Other than that, we can add a little bit of fruit, a little bit of veggies to our diet, and try to seek out sources of omega-3, be that from fish, or I wish I liked fish. I don't. So I take my omega-3s every day, but omega-3s are really good for the brain. And then community, whether we are religious or not, we can be a part of a social group, we can go to church, we can get out in community and enjoy spending time with one another. So, some key takeaways. Faith, mental health research has shown an association between spiritual health and lower depression, anxiety, lower suicide risk, increased longevity. There are a number of different forms of psychotherapy and other treatments for things like anxiety, PTSD. Lifestyle is important. It's not easy. It's not an immediate fix, which is what we all want, but it does work. And the SPECT, so looking at how that can help show different patterns in the brain activity and can be useful in some context, or useful in some cases. But, you know, kind of going back to what we were talking about earlier, not a standalone diagnostic test. It's one part of a big thing that we have to put together as clinicians to help make the best treatment choices for our patients. All right, that's my spiel.